I think we are becoming so keenly aware of the importance of connection and mentorship and how we mentor to ensure for a healthcare workforce that can serve our entire population and its diversity. I was very blessed to have Dr. Payne as a mentor, who was this giant, literally and figuratively, of a man in palliative care, but who was also an African American man who understood me and my unique experience as a trainee pursuing medicine. He lived the reality of being one of few, and this need for physicians who can connect with the Black community because of their lived experience. We have the data now to support the importance of racial concordance in healthcare. Um, this is what we need to be thinking about and ensuring for. But I also will say I've had many people in my life who are from different backgrounds, who are not Black, who have seen me and my experience, you being one of them, Blythe, who have mentored me and encouraged me, and who stand in the gap just because they recognize the importance and because they are good humans and they stand for unity and humanity. So yes, mentorship is important, and I'm particularly thoughtful about the importance of it as we are serving a very diverse population here in the United States and beyond. My heart has always been oriented towards service and serving the underserved, frankly. And as a young girl growing up, I could see even within my own family unit, the impacts of healthcare not being equitable and not being available in the same way to certain members of my family because of who we were as Black people, where we lived in New York City, the dynamics of life. So I think I naturally was oriented that way, but I had no clue the path would unfold exactly as it did. Dr. Payne, I actually worked with him as his research assistant out of undergrad on a grant that he had specifically to look at hospice and end-of-life care in the African American community. And this was in 2001 when no one was really interrogating that. He was at the forefront of that work. And I think it came very naturally to him because of his values. And so by observing him and being mentored by him, I learned how to show up as myself and live into my values while operating in this very, frankly, foreign reality of academic medicine. There's so much about it that is counter to our culture as African American people, but I learned how to navigate it, and I navigated it with pride, also being true to who I was as an African American woman.